With the Republican health care plan all but dead in the House of Representatives, President Trump is blaming Democrats for the plan's failure and predicting the eventual collapse of the Affordable Care Act, or Obamacare.
This is not anything but a Democrat health care, and they have Obamacare for a little while longer until it ceases to exist, which it will at some point in the near future.
So is Obamacare, which will remain the law of the land, really on life support? Dr. Meena Seshamani is a former director of health reform at the Department of Health and Human Services during the Obama administration. She is in our Washington bureau. Doctor, good morning.
Thank you for having me. Good morning.
So let's separate fact from rhetoric here. The Congressional Budget Office, in its assessment of the Republican plan, looked at the Affordable Care Act and concluded the non-group market would probably be stable in most areas under either current law or the legislation. What does that practically mean?
That's correct. So if you're going to require that insurance companies cover anybody who comes in the door, including people who have health conditions for which they would want to use health care, then you also have to have healthy people coming into the market. And that would make the market stable. So the Affordable Care Act does that by two mechanisms. Number one, with the individual mandate. So if people don't come in, if people don't purchase health insurance coverage, what normally would happen is when they get sick, they go to the emergency room, they end up using care, and then the cost gets passed on to everybody else. But with the individual mandate, if they don't get health insurance, then there is a penalty. And so that encourages people to come in and purchase coverage. And the second way is through the premium tax credits, because the premium tax credits, if premiums go up, then the premium tax credit goes up as well, so that people, especially healthy people, don't get priced out of the market. So for instance, about 85% of people in the marketplace get a premium tax credit. And for those people from 2016 to 2017, the average increase in premiums that they experienced out of pocket was zero. And I think another telling fact is that the percentage of young people in the marketplace who are, tend to be healthier people stayed the same from last year to this year, again indicating stability.
The ACA has given health insurance to approximately 20 million people. I think even former President Obama admits, though, that it's imperfect. Do you think it can be fixed?
Well, I mean, I'd like to remember that, we talk about 20 million people. When we talk about those numbers, they're not just numbers, they are real people. So I'm a physician. I practiced and took care of patients before Obamacare and after Obamacare went into effect. I personally had patients thank me. They were able to get care that otherwise they wouldn't have been able to get, and it helped save their lives. So certainly the Affordable Care Act has made a huge difference. I think with any large piece of legislation and any large policy, there are ways that you can improve things. There have been many proposals that have been put out. The president mentioned quite a few of them last year, right. But we really also need to focus on improving value and working, and this was developed in the Affordable Care Act, right, to increase value in the health care that we provide.
All right. We thank you, Dr. Meena Seshamani.